Long wait times at emergency rooms have prompted Knox County to make a temporary change to its ambulance service agreement.
10 News anchor Brandon Bates joining us now with the details in the agreement and why some say this is no-brainer. Brandon.
Well, Robin and John, with the existing contract, the provider is required to respond to all 911 calls with an advanced life support ambulance, which has limited numbers. And now basic life support ambulances will be able to respond to non-emergency calls.
Hospital emergency room wait times in Knox County are up.
Typically, we have prolonged waits where my crews are waiting at an ER for anywhere from 1 to sometimes 5 hours or more.
It's an issue that county contracted American Medical Response has been dealing with for over a year.
Several reasons. We have more counties having to bring patients in from out of county to our local hospitals. There's more patients in the hospitals. There's fewer discharges.
Now, the county and the health department have a new plan to try to cut those times down. The current contract required an advanced life support ambulance to respond to all 911 calls.
The change allows us to use some of our BLS units to respond to and transport the lower acuity patients.
AMR puts their ambulances in two different categories: advanced life support, or ALS, and basic life support, or BLS. The difference between the two: in an ALS ambulance you have one paramedic and one EMT. BLS, you have two EMTs. The difference in those two positions is education and duties they can perform.
It's very frustrating because we're not using our resources appropriately.
Another contributing factor to long wait times is the recent closure of Physicians Regional Hospital in North Knoxville.
It definitely did not help the situation. It probably made it a little bit worse, obviously, when you have 6 hospitals that you can transport to.
Loftus says this 90-day period will put more ambulances on the road, and his main focus
is making sure we're taking care of those patients.
And the AMR operations manager told me that another reason this 90-day period is happening now is because of flu season. And while each case of the flu is situational, they don't want to send overqualified personnel to a patient that doesn't require that type of service. Robin, John.
Brandon Bates on the story.